An experimental Alzheimer's drug has been shown to delay the progression of the disease in patients, but it comes with significant side effects. A study published in the New England Journal of Medicine found that after 18 months, patients receiving lecanemab were 27% less likely to advance to the next stage of the disease. That's a difference of about half a point on an 18-point scale. We're going to explain all of this that researchers use to measure cognitive and functional ability. However, 13% of the patients experienced brain swelling. Joining me now to figure this all out for more is CBS News chief medical correspondent, Dr. Jon LaPook. Okay, John, so let's talk about how meaningful could the change be on the upside of this?
Well, on the upside, we're always so cautious with these things.
Yeah.
We've been disappointed time after time again.
Yeah.
We'll just back up for a second, because what are they trying to do? They're trying to have these antibodies that are targeting amyloid, which is this gooey substance that's in the brain. It has to be there if you're going to have a diagnosis of amyloid. It's a diagnosis of Alzheimer's. It's got to be there. And the theory has been, well, if we suck it out, if we clean it out, then it'll decrease the progression of Alzheimer's. So there have been a lot of drugs that have tried to do this. They've been failures.
Okay.
This targets not just the fibril of the strand, the fiber strand of the amyloid, but the clumps. So they're saying we're doing it in a different way. We're going to have an antibody. And what they did is they looked at people with early Alzheimer's, and they said over 18 months, half of them had placebo, half of them had the drug, and does it help? And as you pointed out, it helps moderately in slowing the rate of decline.
Right.
But it came with significant side effects, bleeding, brain swelling. And so the question is, yes, it's statistically significant, but is it meaningful in real life? And so even the authors said at the end of the study, we need further study.
And does it tell us anything, in other words, if it is perhaps, if the risks outweigh the benefits in this particular use, does it tell us anything about attacking the clumps, whether that is a wise approach or whether, that might then lead to something that might be more effective?
Yeah, so this is, part of this is you always give these sophisticated questions. I'm not just blowing smoke. It's really true, because what you're going at is something called surrogate marker, a surrogate endpoint, okay?
Got it.
Which means, all right, we really want to know, does it slow decline the decline of mental function?
Right.
But one of the things they looked at was brain scans that showed that the amyloid plaque in the brain actually went down. So it was very exciting to see that the drug actually did that. But what's the association between the decrease of amyloid in the brain and the decrease in cognitive function? So yes, it's great to know that it actually works. It's doing what they said it was going to do. But we have to see over the longer period of time what's going to happen after 18 months. And, there were a couple of deaths in the study that people are wondering about, were they related to the drug, or was it because they had underlying problems anyway, they were on blood thinners or whatever. So 18 months, it's good for them. 18 months, 1,800 people, that's a big study, but we really need to see longer follow-up.
As somebody who has experience with Alzheimer's in their family, I know the desperation. And help me understand, as a doctor, in this situation where people are desperate for a cure, how do you help? How do you help patients make these kinds of decisions? This is a trial, I understand all that, but between something that's got these big risks, but that also holds out a little hope for,
Exactly. This is, as you imply, it's a life-crushing illness. I have a lot of experience with it, and in fact, I did a 60-minute piece where we followed Mike and Carol Daly over 10 years. Yeah. And at the beginning, Mike, who's a Staten Island cop, he said, I got this, for better or for worse, and by the end, he had it. And he finally put her in a nursing home, which was the best thing he could have done for her at that point. The caregivers offer other people, they can die before the patient because it's such a stress. So to answer your question, you don't want to take away hope, but on the other hand, you don't want to give false hope. So I think that's why you need these trials. Yeah. You don't want a trial, Aduhelm was a drug that got approved. There was, the advisory committee said, actually there's not enough evidence to do it, but there were all these groups that were advocacy groups that said, look, we need something, so give us this. They approved it, and then it's kind of fizzled out because Medicare wasn't covering it. And so the downside of saying, sure, enter this study, even though it hasn't been shown we don't really know if it really works, is, well, maybe you're taking those people away from some other study. Right. So what you're asking is a great question I deal with all the time, is balancing hope and a realistic explanation of being able to hope for the best, but at the same time prepare for the worst. And the worst with Alzheimer's is gradually terrible decline, which I've seen over and over and over again. And I'll tell you, the punchline with Alzheimer's of the families that I tell them right away is, you cannot do this alone. No way. So you need help. There are organizations, Alzheimer's Association, other ones. People will come in to your house, for periods of time, give you a break, because I'm telling you, the caregivers, the pressure on them is terrible.
Yeah, it is. Dr. Jon LaPook, it's a pleasure to have you here, even with tough subjects like that. Thank you, John.